Thank you, Austin, for the introduction. My name is Hussein. I'll be presenting today on how to write an abstract and then how to turn that abstract into a poster. So this is for the purposes of medical student research. Introduction about me. I'm a recent graduate. I graduated in December. So I'm officially an MD. Former SGA research chair. So I served in this role for 2 terms, almost 2 years. And I'm an applicant this year in March 2024. I have some background in medical research that started back in college, where I was a researcher and lab technician at the Life Sciences Institute in Ann Arbor, Michigan. I have publications in these following journals, and I've gone to 2 national conferences and soon to be 2 local conferences, GAPI in particular. So that's a little bit about me. But who can you go to regarding research currently? Our current research chair is Nicole Palin. This is her email address. And the host today, and also a lunch club facilitator, is Austin Corpus. He's also the research co-chair. So you can reach out to either Nicole or Austin if you have any questions at all. And below is obviously the dean, associate dean, myself, and then a link to the SGA website. Like Austin said earlier, this is the save the date flyer for our inaugural research fair. So this is a really big event for the school in general, and specifically for SGA research, because this is the first time that we're ever going to have a research fair or a research convention that is hosted by our school and for our school. So FUBU, really for us and by us. So this is a big moment for SGA and also for SGA research. So we really want to make sure that everybody knows about it and everybody can attend and or participate. You don't have to be a presenter or a speaker at this event. Everybody's welcome to come and see what's going on. So why is research relevant for medical students? Research is relevant for medical students because it enhances your ability to comprehend medical literature. In the future, you're going to be given pieces of literature, or somebody that you're attending or your co-resident is going to tell you, oh, read this piece of literature that says so-and-so. If you don't have a background in research, you won't be able to comprehend or really understand or even integrate or apply what's in this medical research. So first and foremost, what it does for you is that it enhances your ability to comprehend medical research. Next, it deepens your clinical knowledge base. So I've presented on topics such as treatment-resistant depression, cardiac myxomas, trauma blood, transfusion of uncross-matched blood. So these topics I know really well because I've written about them and I presented about them. So it deepens your clinical knowledge base. Next, it demonstrates a sincere interest in medicine and in a particular specialty. So for example, I want to go into anesthesia in the future. So I attended ASA 2023 last year. I plan to attend ASA 2024 next year. So doing research at any level, really, even if it's at the local level, presenting at the Trinity Research Fair next month, demonstrates your interest in medicine, and it also demonstrates your interest in a particular specialty. Next, it gives you practice in academic writing and critical thinking. As you guys know, medicine is practice, practice, practice. With all professions, the more practice you have, the better you are at this profession. So it gives you practice in writing, and when you're reading it, it gives you practice in critical thinking. Next, program directors or PDs, they want to see a well-rounded application. They want to see an application that includes things like volunteering, community service, leadership, as well as research. They want to see somebody who is able to do an array of different things and to be able to do an array of different things well. And so research is included in those things because, as you guys know, as physicians, it is a taxing job. It is a difficult job. Not everybody can do it well. So program directors want to see somebody who can do a variety of things well. Next, it gives you more things to talk about during residency interview. So, for example, I just went through some residency interviews, and in multiple residency interviews, something we talked about extensively was the things I did research on. So it gives you something to talk about during a residency interview. Instead of sitting there and having, not much to talk about, at least you can fall back on your research. And lastly, whether you guys believe me or don't, during internship and residency, you will have to do research. You will have to either do a poster presentation or a case report or something related to medical research. So if you duck out from it during medical school, you will eventually face it during internship and residency. So getting to grips with it now prepares you for those things in the future. All right, so it's a little bit background on why it's relevant for us. This is a table I pulled from something called Charting Outcomes down here in the match, specifically for international medical graduates in the 2022 main residency match. So I want to highlight two things here. First is the mean number of research experiences. This is things such as being involved in any one of these things, going to a conference, I'm not exactly sure what they mean by, or I haven't looked into what they mean by research experiences, but the mean number for US IMGs and non-US IMGs, whether they're matched or unmatched, is at least 2 across the board. Mean number of abstracts, presentations, and publications. Abstracts and presentations we'll talk about today, but publications are things submitted to journals, such as Curious Journal. And the mean number for US IMGs that have matched is 3, unmatched somehow is 4. So these are just some figures to kind of illustrate to you guys that none of these numbers are not low, for non-US IMGs, unfortunately, they have to work harder than US IMGs, so their numbers are, predictably higher. So this is just to demonstrate that having 0 publications or abstracts or presentations is going to be a detriment to your application. It is going to be something that possibly some programs can see as a negative and as a red flag. So having 2 is infinitely better than having 0. And I'm sure, as Dr. Zubro mentioned in past match workshop and Zoom sessions that he holds, Dr. Zubro is right in saying that research shouldn't be something that you focus on intensely to the point that it takes you away from your learning and your clerkship grades. Your clerkship grades and your shelf should be the priority. It shouldn't distract you from those things. But at the same time, if you're able to, and if you're willing and curious to do it, and if you manage your time well enough, you can produce some research. So Dr. Zubo is right in saying that it's not tantamount, it's not paramount, but it is really, really important. So this is just an illustration I wanted to highlight. The next thing I won't spend too much time on, but I wanted to include is the mean number of abstracts, presentations, and publications of IMGs by specialty, and it goes by matched and unmatched. So feel free to look at this on your own time. But as you can see, the numbers are usually at least 2 or 3. So setting the stage, the purpose of this presentation is to provide instruction on writing a research abstract and then translating it into a poster presentation. Another purpose is to inspire involvement and output of medical presentations and publications amongst clinical students at Trinity's Georgia campus. One of the goals of this presentation is to lay foundations of how to create a poster presentation based on an abstract. Another goal is to provide a peer resource and research mentorship. Nicole and Austin could be your research mentors as well as your peer resource. And another goal is to add at least one research experience to your CV and your ERAS application. Final goal is to motivate clinical students to attend and or participate in Trinity's inaugural research fair on April 5th. So what is an abstract? An abstract is a summary of your research that has 4 distinct sections. It has an introduction or a background. It has a methods, results, and discussion/conclusion. So this format over here is typically for non-case report abstract. This is for more like clinical research, but I will show you examples later on of what a typical case report abstract looks like. But just to highlight, a case report abstract will not include things such as methods and results, but these 2 things will be replaced by case presentation. A case report abstract will include an introduction and background and will conclude with the discussion and conclusion, but the middle part will be replaced by the case presentation. Always follow the 4 C's. Be complete, cover all areas, cover all major components of the project or the case report. So be complete, be concise, be clear, and be cohesive. So concise means you don't add an excess amount of words that are irrelevant or don't add to your abstract. Be clear in the way that you read, the way that you write, so that it is readable, easily readable, and that it is well organized. And also be cohesive, follows in a smooth pattern between the parts, where it's not jumping from one